Let's discuss about other autoimmune disorder, Addison's disease. What is this Addison's disease? Addison's disease causes mainly includes like primary and also secondary. Primary cause worldwide, we see the autoimmune cause is the most common primary cause in worldwide, whereas in India setting the most common cause is the tuberculosis. Whereas what is the secondary causes responsible for Addison's disease is the pituitary causes and also sudden stoppage of the steroids. The sudden stoppage of steroids is mainly responsible for the Addison's disease most commonly, and primary cause worldwide is the autoimmune. And what will be seen in the case of Addison's disease and what antibodies are responsible for the cause of Addison's disease is anti-21 hydroxylase autoantibodies. Antibodies which are directed against the 21 hydroxylase enzyme, and this is the main cause for the Addison's disease. And what are the clinical features we commonly see in this condition is that weight loss will be seen, hypotension will be seen, postural hypotension will be seen, hypoglycemia will be seen, and all the features which include like mineralocorticoid deficiency, glucocorticoid deficiency and sex steroid deficiency. In adrenal gland, we know that there are three layers will be there, like zona glomerulosa, zona fasciculata and zona reticularis will be seen. All the three hormones will be secreted from the, like in zona glomerulosa, mineralocorticoid will be secreted, zona fasciculata, glucocorticoid will be secreted, and zona reticularis is responsible for the secretion of sex steroids. So all these, in case of Addison's disease, all these hormones will be reduced, and the features features occur because of the deficiency of these hormones. And we often see, what are the clinical features we most commonly see is the weakness and fatigue. When patient comes with weakness and fatigue, and even hyperpigmentation also will be seen. What is the cause for the hyperpigmentation is that the raised ACTH hormone, adrenocorticotropic hormone, raised because of a low cortisol and low mineralocorticoid levels. Raised ACTH will be seen, and this raised ACTH is responsible for the hyperpigmentation. Mineralocorticoid deficiency, like pain, abdomen, nausea, vomiting, and postural hypotension, hypovolemic hyponatremia will be seen, and glucocorticoid deficiency like fatigue, lack of energy will be seen, and sex hormone deficiency, loss of pubic hair, loss of axillary hair, loss of libido, and all this will be seen. And as I already discussed, hyperpigmentation is mainly occurs due to the raised ACTH features. And on investigations, we often find hyperkalemia, hyponatremia, raised blood urea nitrogen and creatinine levels, and also low cortisol levels and raised ACTH levels will be seen. And investigations which help for diagnosis of Addison's disease. Investigations which help is the fasting cortisol levels has to be tested. This fasting cortisol levels, what is the range is this? Less than 3 micrograms, often it is a diagnostic for Addison's disease. If we have got if we are not confirm about the diagnosis, then we can do a confirmatory test called cosyntropin test. And also, as I already said, antibodies responsible for the Addison's disease is the anti-21 hydroxylase antibodies. So we often find high titers of anti-21 hydroxylase autoantibodies. And what is the treatment for this is that steroids, as this condition is mainly, all these features are because of the low steroids. So that is the reason we give treatment is the mainstay of treatment will be the steroids. And what is the complication if you don't treat is that the patient then usually will land up into Addisonian crisis. In case of Addisonian crisis, also the mainstay of treatment will be the steroids. And the main important features is that steroids should not be stopped abruptly. A tapering dose of steroids must be maintained by any patient. If it is main thing is that never stop the steroid uses suddenly. So steroid uses must be tapered slowly. Only then we can avoid this Addisonian crisis, which is a complication. In case of this Addison's disease, we on CT scan we find small adrenals or normal adrenals without any calcification. And this condition usually had HLA association and also association with the other autoimmune disorders. Thank you for watching.